Good afternoon, everyone. Thanks for joining us for the weekly briefing today. We're going to get started with our friend Christy Mishi from the Health Department with an update on COVID-19 information. Good afternoon, Christy.
Good afternoon, everyone. Just want to start out by saying Happy Public Health Week. Just want to thank all of my friends and colleagues working in public health. And I'm really grateful for all of their dedication and their service. So just want to put a quick shout out to them before we get started. And I know we'll hear more about Public Health Week later on in the briefing. I think, Monterey County's in a pretty good place right now. Our data are pretty much stable. Our most recent case rate is about 4.6 per 100,000 population with a test positivity of about 2.2%. We have about 11 people hospitalized who have also tested positive for COVID-19 right now. And our effective, which is a measure of transmission, is below 1, which means that at this point, transmission is decreasing in Monterey County. We do continue to watch all of our metrics and situational awareness measures, including some of those non-case related measures like wastewater surveillance, electronic syndromic surveillance, and some of those additional measures so that we can have a good picture of what's happening in our community and can make sure that we're letting people know if our status changes moving forward. Did want to mention very briefly that the California Department of Public Health has made a change in their frequency of publishing their statewide surveillance information. So if you've been checking the CDPH data site, you'll notice that now it's dropped to updating twice a week, very similar to Monterey County. Monterey County does update on Mondays and Thursdays. The state health department is updating on Tuesdays and Fridays. So there's just that shift into looking at long-term trends rather than day-to-day changes. The other thing I wanted to mention today was really talk about boosters. So the FDA issued some eligibility for additional groups of populations to get a second booster. So those that are eligible currently for a second booster include individuals who are 50 years of age and older, if they've gotten their second or their first booster at least 4 months ago. The next group is individuals who are 12 years of age and older who are moderately or severely immunocompromised. Again, the second booster being 4 months after the first booster. Now, what constitutes moderately immunocompromised or severely immunocompromised? Well, we're really thinking about people who have had a solid organ transplant, so like they've had a kidney transplant or a liver transplant. They are taking medication that suppresses their immune system, like somebody who's undergoing treatment for cancer, chemotherapy, or somebody who may be taking immunosuppressive treatment for an autoimmune disease. So people whose immune systems are really depressed and may not have responded as well to the original boosters. We want to make sure that their immune levels remain high so that they're very well protected against severe illness. The last group that they extended eligibility for was individuals who received their initial dose of Johnson & Johnson vaccine and then had a follow-up booster with Johnson & Johnson. Those individuals are also eligible for a booster 4 months after their first booster dose. And what the recommendation is for those groups is to really consider getting a booster with one of the mRNA vaccines, so Pfizer or Moderna, instead of getting a third with Johnson & Johnson. And I believe, Amaya, that's kind of the synopsis I have. I'd be happy to take any questions anyone might have.
Thanks, and thanks very much for running through the booster information. I know, people are seeing a lot about boosters right now, and they, want to know if they are eligible. I do have a question for you. Has the number of BA2 subvariant specimens increased in Monterey County?
That's a great question. And sorry, I should have brought that up and talked about that. So we haven't detected any additional BA2 variants. Right now, we're still at 3 for Monterey County. However, I would say that I think that We haven't been receiving as many specimens for subtyping whole genome sequencing as we have in the past. So less people are getting tested, and among those that are, our test positivity is really low right now. So we only have a very few number of specimens coming in. Therefore, we're really relying more on the statewide and regional data to think about what our status is in terms of BA2. So CDC recently updated their projections for Region 9, which includes California, and their estimate was that our region is at about 75% BA2. So we're probably somewhere very close to that and similar, and I think that's the best data to watch for right now while our sample sizes are so small for whole genome sequencing locally.
Thank you. Are there any other questions for Christy? I only had the one, giving people a minute or two to, not even a minute, to type up something. You know, I'm not seeing anything else coming in, but Christy, if we have any additional questions that come in after you go off the call, we will forward them to you. Sounds
great. Thank you so much for having me today.
Thank you. And as Christy mentioned, it is Public Health Week this week. Christy's celebrating, I think, well, you can't have cake at the health department, but if they could have cake at the health department, they would. It's a reason to celebrate. Public health has been certainly top of mind during the pandemic, but it has many other areas of work. And in Monterey County, one major effort is health equity. We're very pleased to have Vicente Lara, a program manager from the health department, to talk about health equity and, of course, Public Health Week. Good afternoon, Vicente.
Good afternoon, Mia. Thank you for the quick introduction. Let me see if I can I share my screen? I do have a PowerPoint. Okay,
please.
Let me get that up real quick. And all right, I'm gonna try to run through. Can everybody see that? Is that coming through?
Gotcha. Great.
All right. I'm gonna try to just run through the slide deck as quickly as possible. I know you gave me about 10 minutes, so it's good. It's good information, but I think there's quite a bit there. So again, my name is Vicente Lara. I'm the Health and All Policies Manager and one of the co-health equity leads for the Monterey County Health Department. And yeah, again, I just wanted to take this opportunity to acknowledge that this is Public Health Week, and we wanted to really highlight some of the health equity work that we're doing here at the health department. So before I jump into all of the work that we're doing at the health department, I just wanted to do a quick review of a definition around what we mean by health equity. This definition comes from the CDC, and it states that health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Unfortunately, we still have many long-standing health and social inequities that put some groups at risk for poorer health outcomes. One of the things we do want to differentiate when we talk about health equity is the difference between equality and equity. And so there's a picture here on the slide that has a couple of examples of equality versus equity. In the top half of the picture, we see that equality is essentially the distribution of resources to individuals or a group of people. And in this case, it's bikes. Everybody gets a bike. It's the same bike, same size bike. And as we can see, that bike may fit some people, but it may be too big for other individuals. It may be too small for some individuals, and it may not even be able to be used because of some individuals' abilities, right? On the other hand, when we look at equity, we see that the resource or the bike is distributed based on the individual circumstances. And that's really important because when we talk about equity, it's about acknowledging the individual circumstances. And so when a resource or an opportunity is distributed, those circumstances are taken into account. And that has been a really important lens when the health department and other health equity advocates have developed strategies. again, like I mentioned, there have been historic health and social inequities that we see today. And I think COVID really put a lens on some of those inequities front and center in a lot of cases. And here we have a slide that just demonstrates some of the early data that we were getting around COVID and how it was affecting different groups in the county. So who you are matters, unfortunately. Latinx residents make up roughly 61% of all residents in Monterey County, yet faced a disproportionate impact from COVID. So in July 2020, early on in the pandemic, the data that we were getting was that 93% of reported COVID cases were among Latinx residents, 85% of hospitalizations, and 77% of fatalities due to COVID were among Latinx residents, even though they only made up or make up 61% of all residents in Monterey County. So we saw a disparity there. And this was across the state. The state was acknowledging that there were disproportionate impacts from COVID among many communities of color throughout the state. So this wasn't just happening locally. Yet, when we acknowledged that this disparity was taking place, different strategies began to be implemented. So projects like the VITA Collaborative, the stipend program, partnerships with other nonprofits and community-based organizations to really develop strategies that were culturally appropriate, linguistically appropriate, again, really taking into account those who were being disproportionately impacted, taking into account their circumstances, developing strategies to really address this disproportionate impact. And as we can see this week, some of the rates reflect a closing in the gap between what we were seeing at the beginning of the pandemic and today. So 76.9% of reported COVID cases among all COVID cases, 76.9% among Latinx residents, 67.9% of hospitalizations, and 56.5% of fatalities among Latinx residents. Again, much more in line with the total population of the county. Where you live also matters. My supervisor and colleague, Krista, will be talking about the importance of health needs assessments after I finish, but I just wanted to highlight a data point that came out of the 2019 Montage Community Health Needs Assessment Report, which states that 26.4% of Marina residents report fair or poor health, compared to 9.5% of Pacific Grove or Pebble Beach residents, right? So 1 in 4 residents in Marina report fair or poor health, compared to roughly 1 in 10 residents of Pacific Grove and Pebble Beach that live in Pacific Grove or Pebble Beach. These two communities are roughly 10 miles apart, and yet we see reported health very, very differently. And so we know that a community's access to resources, a community's infrastructure, right? All of these play a role in health outcomes. And again, another reason why we feel the need to bring in that health equity lens in some of the work that we're doing. And it's not to say that it's 1 or 2 individuals' responsibility. It's acknowledging the fact that there have been long-standing historic health and social inequities that impacted certain groups in the past and continue to impact groups today. And so we really want to think about how do we address those differences moving forward, again, to achieve that vision that regardless of who you are, where you live, you have the full potential to live a healthy life. So again, this is why we feel very aligned, and again, wanted to just talk a little bit about Public Health Week, because Public Health Week has really incorporated this equity lens in its event this year. And again, you know, the overarching theme is public health is where you are. And again, that previous slide that I just showed, very, very true. Depending on the kinds of resources that you have as a community, or the kind of built environment you live in, huge factor on the kinds of health outcomes that you have for your residents. Climate change, take action for equity. Again, really thinking about how the changing environment, how a changing climate will impact different communities differently, and taking into account those circumstances so that we can develop strategies for resiliency. Collaboration and resiliency, another important theme. The VIDA Collaborative really focused on building those partnerships, both with community-based organizations and incorporating feedback from residents directly to figure out how best to address this disproportionate impact in COVID. So just an example of why it's really important to collaborate and build partnerships with both internally as a health department, but externally with our community partners as well. And closing the health gap for equity, or closing the health equity gap. Again, really looking at some of that initial pandemic data, seeing how it was having an impact on different communities differently, and figuring out strategies to close that impact. So a lot of alignment with this year's Public Health Week in terms of the work that we're doing today. A couple of projects that I just wanted to highlight that really speaks to our health equity efforts. Our active transportation and ciclovia events that we have been doing here at the health department in partnership with Building Healthy Communities and the Transportation Agency of Monterey County, Ecology Action, a couple of other partners that we're working with around safe routes to school. But again, the reason we are engaged in ATP work, active transportation work, is because we see the importance of the built environment and its role in promoting health. A really strong intersection there. Again, I mentioned the COVID community outreach of the VIDA project, elevating the voices of community-based organizations and the constituents that they work with to really develop an effective COVID response strategy. I think there's been a lot of lessons learned from that work that we hope to carry forward. And our health and all policies and health equity work has been a lot of the initial projects and some of the initial work that falls into this, this bucket has been established and has been worked on for some time now. But the California Department of Public Health and the CDC recently are funding a two-year grant to not only move those targeted activities forward, but also to have local health departments and local health jurisdictions think about the kinds of infrastructure they need to carry that health equity forward for the long haul. And so that's called the CERI, or the California Equitable Recovery Initiative grant that we will be working on over the next couple of years. And just wanted to show this graphic from the CDC, which is the Paving the Road to Health Equity framework, which really informed this CERI grant. And again, kind of two buckets of grant activities that we'll be working on. First is the health equity infrastructure focus, which is assigning and identifying health equity leads within the health department, developing a health equity plan, which will be stewarded by a task force made up of different department representatives within the health department, and really thinking about the kind of professional development and workforce development that will support the implementation of some of these strategies identified in a health equity plan. So that's what's happening internally within the health department. And then some of the targeted activities include health and all policies convenings, where we're bringing in non-traditional partners, folks who aren't necessarily engaged in public health, but play a big role in public health. So for example, transportation, we're engaged in active transportation work, and we're talking to transportation agencies, not necessarily traditional partners engaged in public health, but play a big role in bringing in resources for infrastructure that promotes health. Health and racial equity narrative shift, again, working within the health department to bring that equity lens to our day-to-day work. The project that we have going on within the health department is called the Health Equity Scholars Academy, where we train and work with staff within the health department, raising the consciousness around health equity and getting staff familiar with the concept. Promoting health and racial equity analysis. Part of this is health department staff sitting at different decision-making tables where we see that intersection between things like, for example, housing and health, like I mentioned, transportation and health, economic development and health, really sitting at these different decision-making tables where we can bring in the health and racial equity lens to the conversation. Centering community voice for equitable recovery is really the work that the health department has been doing with its Enlace program, training residents on how to be advocates to advocate for the different needs that they see that still need to be met. And health equity data and tracking. Again, I'm not going to jump into a lot of the data because I know we're going to talk a little bit about that in a little bit, but the most important part about making sure that we have accessible data, health equity data is, if we don't know how our efforts are affecting the community, the county in general, we're not able to ensure that we're actually moving the needle on some of these issues. So we want to make sure that we're tracking our efforts and making sure that we are actually moving the needle in a direction that needs to go. Again, just a general timeline for this CIRI grant that we really have a lot of faith will institutionalize and operationalize a lot of the work that we're doing. This grant will cover the next couple of years. But like I said, we're really hoping to deepen our work and really institutionalize our work, our health equity work moving forward, even after the completion of this grant. So I'm going to end there and see if there's any questions. I hope that wasn't too much information. I tried to squeeze a lot in there, but feel free to ask any questions that might.
Well, you did squeeze in a lot of information, but there is a lot of information to share. And I think this gives people a chance to see how big Public Health Week, when you're talking about marking, a week for work done by an agency, there is a lot there for people to know about. I don't see any questions coming in chat, but I do have a question. If you could have anyone to have one takeaway from Public Health Week, they've got a great, kind of theme about public health being where you are, and you've got all this work going on. For the average person, what would you want their takeaway to be about public health?
That public health, I guess the theme overall is, public health is about where you are. And we have a health department that really wants to meet residents where they're at, listen to the lived experience of those residents so that we can develop strategies for public health in a way that's really meeting the needs based on those lived experiences. So I think that's, and that really ties in very well with that health equity lens overall. And it's great that Public Health Week this year is really incorporating that lens as kind of this core theme for all the different days that they want to focus on during the week.
And one more question, a lot of people say, what is one thing that someone can do, that whole one thing? If you could have anyone do one thing, maybe to either change their perception of public health or change their perception about their lifestyle or the lifestyle of their community, what would that one thing be?
I think the best thing that I would recommend anyone to do is get involved. Get involved, whether that's your local Safe Routes to School project. We have a couple of walking school buses that are taking place, a couple of walking groups that are taking place this year, some of the different schools. Take advantage of different recreational opportunities. If you want to take it a step further, go to a city council meeting, go to a board of supervisors meeting. Let your local representatives know, that you may be experiencing a specific health issue in your community that you want to address. Just get involved. Talk to your neighbors. We have some really interesting informal groups just that are happening throughout the county. Informal walking groups of folks getting together and building building community, which I think is so important right now as we come out of the pandemic and kind of enter this new phase of the challenge with COVID. Just finding those reconnections with our neighbors and our friends, because I know a lot of folks maybe haven't seen close friends in some time. So I think just reconnecting, getting involved, getting engaged with your community locally.
Really good advice and really great suggestions. Thanks very much, Vicente, for talking about Public Health Week and those good things that people can do.
Definitely. Thank you.
Well, thank you. And we're going to keep on the health topic. All 4 of our local hospitals, the United Way and the Health Department, have come together as the Monterey County Health Needs Collaborative. The collaborative is launching a community survey to better understand our county's health and social needs. And we've got some people here to talk about that today. Chris Tahani, who's our Planning, Evaluation, and Policy Manager with the Health Department. And also joining her is Monica Tovar, who is a parent and a local business owner and is going to talk about her experience with this project. Good afternoon, ladies.
Good afternoon. Monica, I'll just get going and then introduce you at the end, if that's okay. And so I'm here today to talk about the Monterey County Health Needs Collaborative, and I'm a representative of a fairly good-sized group of folks coming from the Health Department, the 4 hospitals in our county, and United Way. And it is a part of Public Health Week. We are launching a survey as part of the collaborative this week. And as Vicente was saying, public health is where we are. And together, really, we can make our communities healthier, stronger, and safer. And we do want to hear about that community voice, about where the health issues are and where there are gaps and where we can strategically focus the collaborative efforts across the hospitals, the Health Department, United Way, and with other collaboratives and initiatives out there. And this is really underscores one of the days of Public Health Week about community being about collaboratives, working collaboratively and supporting community resilience. And so the collaborative, trusted entities, we've been working together closely during the pandemic, and that's really been about providing the community with education, resources, vaccination clinics, testing, and more. And through that collaboration, it led us to consider where more other areas we can collaborate and be strategic together, helping with efficiency across our agencies as well. And one of those areas, especially to work on health inequities, would be around our community health assessments and community health needs assessment. So the collaborative came together this past year to start broadening that partnership and thinking about how we're leveraging resources to meet those common health goals that get identified in assessments and by the community. So as I mentioned, we've produced community health needs assessments in the past. We haven't been on the same timeline before. They're slightly different timelines. So now, as we've been discussing and trying to get those timelines to align, they really have aligned this year.
Krista, I want to jump in. Your slides aren't advancing. Did you mean to advance them?
I do. I'm advancing on my screen. Isn't that interesting? So let me stop that share, and I'm so sorry about that. I'm really glad you let me know that. Can you see the slideshow?
I can see it now, and it's a different slide
view. Yes,
it's a better view.
Okay. I might have to restart it when I come to the video, but that's okay. I can do that.
Okay.
So as I mentioned, we have the alignment this year starting where we're going to have one survey. We're doing it together. It has part of it is that it's going to allow us to be more efficient for community time as well, instead of communities maybe having different surveys being announced to be asking for similar information. And then also as we look and assess the data to allow us to align strategies and efforts as we identify trends and the major health issues in the county. Some of those may be health issues that have been identified in the past, and we'll be able to also look at how strategies and initiatives underway have potentially reduced health inequities. And then As we move forward, we may be working individually. We may also be working together to enhance health programs that are in place, or to identify and maybe bring in resources to reduce gaps that are identified by community, by race, ethnicity, by age or gender. So, as I mentioned, we came together during the pandemic, and now in fall, we began to talk about how we could do these needs assessments together. And we're working with the California Hospital Association to do a request for proposals, and through that picked professional research consultants who are now helping lead the way for us and looking at all the secondary data that's out there from other trusted sources like the California Department of Public Health and birth and death data, and then also looking at collecting data in a primary way. A primary data collection is called by doing a survey with the community. And so they're assisting in that survey development and deployment. And then we're assisting and working collaboratively on disseminating the information about how to access the survey, and then when we get the reports later, on what those key issues are. We also are asking, besides the community survey, asking over 300 key informants for their input on community health issues. And that survey was sent out in March and will be closing soon for the key health informants. And those key health informants, they're from multiple sectors and partners. They include city, agency, and organizations across the county. So as I mentioned, and why we're launching this week and being part of Public Health Week, is the community survey. It's just opening today and it'll be closing in mid-May. We have the press release out about it. There'll be flyers and posters that'll be put up around the county. We'll be getting information out through a variety of other newsletters, and really also trying to reach out to the community organizations, the grassroots organizations, so they can let their community members know about the survey. And then once that data is in, the consultant will help us analyze all of the data, consolidate it together, produce reports for the different hospital service areas, as well as the regions in the county that we've used for health department data and reports before. And coming out in early fall, then the collaborative will have those key issues identified based on the data, and hopefully also working towards developing those strategies, refining strategies that have been in prior health needs assessment reports and the efforts by the agencies and organizations in the past to address some of the issues that were identified. So as I mentioned, there will be broadly disseminated this website where the survey link is, and we also will have QR codes on all our flyers and posters. It can be done on a smartphone. It'll be in English and Spanish. So this is where I think I need to stop sharing again. And so I can share so you can hear this. And let me share properly again. Oh, great, share the sound. So this is just one example of some of the dissemination strategies. We have the short PSA that the collaborative has developed.
The Monterey County Health Needs Collaborative is working together to improve the health of our community. Help shape the future of health in Monterey County. Please take our confidential survey at healthymontereycounty.org. The Monterey County Health.
Great. So that did play, right? Great. So I would just like to introduce now Monica Tovar to talk about, as a member of the community who's participated in community health needs assessment survey in the past, and as encouraging the community and why it's so important to have community voice as part of the data that's collected.
Thank you, Krista. Thank you, Mia, for having me today. I really appreciate you guys making the time to hear my voice in regards to the needs in the community. My personal experience really going to the website, it was nice to go to the website, and then when I couldn't finish it, I went straight to my phone and I was able to move forward and get it done as needed. I find it very important with my background, with my father being diabetic. Filling out forms like this definitely gives the the collaborative, more information of what our community needs are, especially when we've been able to come out of this, the diabetes center that we have here locally, from other collaboratives from the past and the research that was found from here. So I find the value definitely, and of course our needs have changed. In the last 2 years, everything has drastically changed in the last 3, 4, even in a year ago. So the needs and taking the survey, I find is super important for our community because of the fact that everybody's changing, whether it be diabetes, whether it be mental health, just having access and overall for our health abilities is something that I feel that our community really needs to strive for when it comes to filling out surveys like this. And I'm really grateful that the hospitals got together and just kind of came together. Unfortunately, under these circumstances, we were able to find out, you know what, we can work together. And I love that they did that because it's just all coming back to our community. So it was very short. I am a busy mom and I have a business. So it did take me about 30 minutes to fill out, but it was very easy. It was just a matter of just getting it done. And it was really important for me to do that. So if anybody has any questions, feel free to ask away.
Well, I'm going to jump in and say, I'm glad you talked about how long it took to take the survey, because people wonder when they say take a survey. And I do at the beginning of the survey, and you might want to go into this a little bit, they say, will you make the commitment to take the time to fill out the survey? Why is that important? That you don't want people to rush and just blow through the survey?
Well, because the input that someone has is going to obviously influence of what the county is able to do for you. It's definitely something that if you don't communicate what your needs are, it's not going to be implemented. And then people wonder why things aren't executed. Well, if the county doesn't know, then it can't be done. So that's what I found out is, okay, I got to make the time. Either I got some interruptions, but I still got it done. And that's probably why it took me a little longer, but I knew I needed to get it done. So it was important to me, and I knew it was important for the collaborative to find out what my personal needs were. Again, and I know there's a lot of people out there that have needs that are not the same as mine. So we want to make sure we're taking care of all our community members, whether whatever your status is. And then I want to make sure that our elderly is taken care of, as well as, you know, our younger folks, and then just all varieties of all needs. So that's what I wanted to make sure that we communicated today. And I'm excited to hear that that's launching this week. So thank you.
And Krista, just piggybacking on what Monica was saying, the data is going to come in, and it is important that people take a moment and, you know, write down their experiences, even if they think they're the only one, because somebody else is going to have a completely different experience. And how does that affect the data that you're pulling together?
Well, we're hoping to collect thousands of responses with the survey, and so that we can, in aggregate, look at the data by region, by the service area, like I said, by race, ethnicity, age, gender. And that allows us to identify where there are specific populations or needs in particular geographic areas in the county, to then develop more specific strategies, interventions, partnerships as it relates to what's been identified, you know, from the community and from the secondary data.
So people should be looking for the announcements about the survey. They should see them. They be on TV? Tell me where they can find and the information and links to the survey.
So we do have the website, which I did provide. We'll be posting that on the health department website, all the partners' websites. It'll be going out in newsletters by the partners. We'll be getting it out to a wide range of community organizations for them to get out into their newsletters, out through their social media. So I'm hoping individuals may see it multiple times as part of that encouragement. And then we'll also be looking for where we might have a few gaps in that dissemination, and then we'll fill it. We do have community health workers. We have a lot of programs that are out there that potentially we could then get messaging out again during the course of the survey being open. And so, yes, on TV and radio as well.
Well, there's nothing like redundancy for a good cause, right? You want to see it many times to get people to take the survey. And the website is healthymontereycounty.org. People can go directly there, or whatever the links say, wherever they happen to see it, follow the link to the survey.
Yes, and if others have ideas of where we could be disseminating, we would love to hear. And that people, we can have them email that to the health department. Has a webmaster link, and they can email any ideas to us there.
Thank you both very much for talking about the survey and the collaboration. It's really great news. Healthier the better.
Thank you so much.
For the opportunity to profile this in Public Health Week too.
And then finally, our last topic is coming up on May 1st. The new older adult expansion will give full scope Medi-Cal to adults age 50 and older who qualify for Medi-Cal. Now, what does this mean to you, and do you qualify? We've got someone here to help us understand that. We're very pleased to have Yana Venegas-Berget with our Department of Social Services. She is the outreach coordinator for the Community Benefits Branch. Hi, Yana. Tell us a little bit about this.
Hi, thank you for the introduction, Mia. So good afternoon, everyone. I am the outreach coordinator for our Community Benefits Branch, and I do have some information today on what we need to know concerning the Medi-Cal older adult expansion. So I do have a short presentation to share with you. Can everybody see my screen okay? Awesome. All right. So the older adult expansion will be effective May 1st of this year. So the expansion extends eligibility for full scope Medi-Cal to all people who are 50 years or older and who meet all Medi-Cal eligibility criteria, and immigration status does not matter. So notice was sent to existing Medi-Cal beneficiaries 60 days prior to May 1st. So these notices went out already. Prior to the implementation to the mailing address on file. So the first notice included information, general information about the older adult expansion. It included frequently asked questions that provide information about full scope Medi-Cal, Medi-Cal managed care plan benefits, and how to get more information or help. For individuals who applied for Medi-Cal after March 1st, and up to implementation date, the first notice was included in the materials provided at the time of application. So individuals who are currently enrolled in restricted scope Medi-Cal will be transitioned to full scope Medi-Cal effective May 1st, 2022. So restricted scope Medi-Cal beneficiaries did receive an advance notice regarding the transition of their benefits. Information was included to inform them that there is no action required on their end. However, if the Medi-Cal annual redetermination falls in the transition period and the county cannot renew their Medi-Cal using an ex parte review of the information available, then these individuals will receive an annual renewal packet to renew their Medi-Cal eligibility. So individuals who received a renewal packet must provide the county with the requested information. So individuals who do not have active restricted scope Medi-Cal, they can apply online, by mail, by telephone, or at their nearest local county office by fax or in person. So individuals can apply via these methods, and they will also receive the appropriate notice of action notifying them of their eligibility for full scope Medi-Cal benefits, which will be in effect no sooner than the month of the implementation date, which is May 1st, 2022. For applicants can request retroactive Medi-Cal coverage for up to 3 months prior to the month of application. However, under the older adult expansion, full scope retroactive coverage will be available no sooner than the month of implementation, which we know is May 1st, 2022. And eligible older adult expansion individuals who request retro coverage for any months prior to the month of implementation will be granted restricted scope Medi-Cal based on the current eligibility process policies in effect. So just a quick recap on what services are covered under full scope Medi-Cal. So full scope Medi-Cal does cover outpatient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, programs such as physical and occupational therapy, laboratory services, and preventive and wellness services in chronic disease management. And so these are the 5 ways to apply for Medi-Cal. So as I mentioned earlier, you can apply online. So either via www.benefitscal.com, or they can also apply online through Covered California, by telephone. And so I have the information here up on the screen, and of course by mail or by visiting one of the local county offices located in Salinas, Seaside, or King City. So there will also be asset limit changes. So on July 1st, the asset limit for Medi-Cal programs for people who are 65 or older or disabled is also increasing. These changes apply to things you own, which can be counted for Medi-Cal eligibility. The asset limit changes are as follows. So the previous limits were $2,000 for one person and $3,000 for a couple. So the new limits are now $130,000 for one person and an additional $65,000 for each additional family member. So for instance, we add $65,000 for each additional family member, which means for 3 people, the limit goes up to $260,000. For 4 people, $325,000. So there is also no action required from current Medi-Cal beneficiaries for this change. There is nothing that they need to do. And just some additional information also that beginning January 1st, 2024, the second phase of the new law in California will also eliminate the asset limit for all non-Magi Medi-Cal programs. So additional information will be made available at a later date, and this is all we know now. So that's all I have. And I did want to just close by informing everyone that May is also CalFresh Awareness Month. And our outreach project is also actively working on creating material to promote CalFresh. So Maya, I'd love to come back and share information on CalFresh next month, if that's possible. And I just wanted to encourage everyone to follow our department on Facebook or Instagram to stay informed.
Yes, and of course, we'll have you back for CalFresh. It's such a great program, and there's a lot of good information to come out about that. So let me, I'm going to stop your share there for a minute and ask you, how many people do you think this expansion will be impacting in the county?
Oh, well, it is going to impact, you know, a large number of individuals. I mean, this is going to affect everyone who's 50 years and over. So I don't have an exact number, but it will affect a large population.
So people should take a look at this and find out if they qualify, and, you know, not just automatically assume that they may not qualify.
Right. So everybody's definitely encouraged to apply if they're not already receiving benefits. And I think that, you know, the best thing that everyone can do is to just stay informed. If they have any questions, or, you know, if there's any doubt, they should contact, you know, their nearest local office to just ask. And, you know, it doesn't hurt to just submit an application and have eligibility reviewed to determine, you know, if they are or not eligible for Medi-Cal.
Great. Thank you very much for walking us through this change. Really important information for the community. And then we'll see you back next month for CalFresh.
Thank you, Maya. Thank you, everyone.
And thanks everyone for joining the briefing this week. Our next briefing will be next week, and we'll see you then.